All right. Good morning, everyone. We're just getting started here with our meeting. I'm going to go ahead and make sure that I'm connecting this to our Facebook Live. As I'm doing that, I'm going to hand this over to Velma Palacios, our president of the Saipan Chamber of Commerce, for opening remarks.
Half a day, everyone. Thank you for joining us on our first virtual GMM. It's been a while since this pandemic, and we felt that we need to communicate with our membership. All we've been doing is sending out updates as best we can, and I thank our staff, our executive director, and our coordinators, Lonnie and Franco, in doing everything they can to keep you all, our membership, updated. So we're very fortunate to have wonderful speakers today. We have Governor Torres and Chairman of the COVID Task Force, Warren Villagomez. We have Congressman Kilili and his entire team from the Congressional Office in Washington, D.C. Although it's late, we welcome them and thank them for joining us today. We also have Secretary Benaventi and her team from the Department of Labor, and of course our CEO of the Commonwealth Health Corporation, Esther Munia, and her team from the Bureau of Environmental Health. As you know, that the governor has continued to lift certain restrictions, and we look forward to trying to get back to normal operations in the next few weeks, coming months, and all that, of course, with social distancing and other guidelines to protect our employees, our community, and everyone out there. So we thank everyone for doing everything they can and opening up their businesses during this time. We thank our frontliners and just entire community for being proactive and also following all the directives that the governor has issued. So with that, before we turn over to Maxine, I would like to also welcome our chamber members and all those joining us on Facebook Live. So our chamber office is open Monday through Thursday. We're not working from home anymore. So we're back to, the office. Also, I know one of our big events is our golf tournament. We're still evaluating that. And the golf tournament is one of our biggest fundraising event for our scholarships to our students. And then I think that's it. So with that, I'd like to turn it over to Maxine for logistics, and then we can proceed with our meeting.
Thank you so much, Velma. Before I get started talking about the logistics of this presentation, I did want to just say that we are starting a Tested and Open for Business campaign with our chamber members. We're encouraging all of our chamber members to have their employees get tested and then also promote that they're opening for business. So if you are tested and open for business, go ahead and send us an email at coordinator2@saipanchamber.com. If you also post on Facebook, go ahead and hashtag tested and open for business. And like I said, we're just trying to encourage as many employers as possible to encourage their employees to be tested, so both their coworkers and our community just feel safer. So thank you again so much for everyone joining this call. Thank you again, Governor, Congressman, Secretary, and CEO Munia, also for being speakers on this call today, as well as their support staff. We really appreciate them taking the time. So for the setup of the meeting, we're going to have each presenter do about 10 minutes of their presentation. We're also going to be doing 5 minutes of Q&A right after their presentation. To ask a question, you can either email myself, it's Maxine on the Zoom. You can email or message Franco Santos, SCC, he's another participant on the Zoom. And then we also are taking the comments on our Facebook and our Facebook Messenger. So we'll be compiling all of the questions, then asking them to the speaker at this time. So I think that kind of sums everything up. we'll go ahead and get started. Thank you again so much, Governor, for joining us today. I also see that Chairman Villagomez is on as well. We'll go ahead and turn it over to Governor Torres. Thank you.
All right. Good morning, half a day, and for everyone that's on the line, I just want to acknowledge Congressman Kilili. Buenas and welcome back to everyone else. Welcome again. We have a lot of working movement moving forward on reopening CNMI, and of course, first and foremost, I want to thank all of you for your continued support in opening up CNMI, and along with Esther Muñoz, our CEO, and Warren Villagomez, our chairman, for the COVID-19. Regarding the Governor's Council of Economic Advisors and the Economy Recovery Plan, obviously we do have different colors, and we're reaching, we're yellow, and now we're moving forward on getting the blue. But with your continued support, with Chamber encouraging all of the employees, and perhaps even a stamp or certification that the business is open and ready because they've done their testing, it's really an awesome news to hear, and the encouragement of having all the employees not just bring comfort to our community, comfort to our business partners, but also a strong statement to our tourist industry that when they do come here, that the employees have been tested, and makes the working environment safer. So with that said, we have just working with all of our partners and looking at the safest way to reopen their businesses and establishments. There's different establishments requirements, occupancy, availability of workforce. But we are here to assist. Warren Villagomez is here, our chairman, as well as Esther Muñoz. This is a totally different way of, again, of our declaration. We all know that. So trying to find the new norm in the community and to our business partners is something that, as long as we're all working together and addressing those concerns, I believe that we will make it work. So I'd like to ask also Chairman Warren, since I think I have him and I on the list as 5 to 10 minutes, and I also would like to give more time for questioning.
Thank you, Maxine, and thank you, Governor. So just an update to start off from where we at with the COVID-19 task force, all the efforts that we've been doing. First of all, want to update our alternate care site. That is moving forward as planned. We met yesterday with the construction and engineer, and they're in the final stage of closing out all the necessary last parts of the build-up. So right now we are we're just waiting for a few more medical equipments that will be arriving in a couple days, and those equipments will be bench tested, and we will start placing them at their appropriate sites within the Canoa alternate care site, and able to start phasing into the facility and working along with Dr. Tadella to make sure that all the necessary parameters to meet the treatment requirement are met for the services that we are looking forward to provide at Canoa facility. As well as we still have our PIC active site for inbound quarantine passengers, guests that are arriving here in the CNMI. That is actively engaged and operational. We have Department of Community Cultural Affairs, DFEMS and DPS that's facilitating that facility, as well as today on, the state would carry the logistical operation of canoa along with Dr. Turella. CACC had created a unit that used to handle canoa with the surveillance team to build on a larger scale of surveillance activity within CNMI to also engage on other infectious disease that are in the area that could potentially be a threat to CNMI. But all these leading efforts, enhancement of processes that we work along closely with CEO Munya to continue on all the mechanisms that should be in place to safeguard our island community. So as we speak in regards to canoa and PIC, we are also actively utilizing the medical care and treatment site up at CACC. So that's a unilateral services that's been used, that the task force had engaged with CAC. Down the road, that facility would be a surveillance center for the unit that's will be created by CACC. So all the efforts and construction and build up that the governor had outlined and the lieutenant governor are being maximized at this moment of time. So it's a unified effort and unified collaboration with holistic government approach, from daily operation to personal protective gears, and as well as the utilization of facilities like what we're doing on a daily basis for community-based testing up at the Commonwealth Ports Authority. Again, the engagement with CPA, all the support from their Ports Authority personnel to their operation to be able to function and continue on the services that and the testing that we are aiming for this community. And the numbers are very positive to that that we're getting on a daily basis. So from Saipan and Naroda, all the efforts from the municipality level to the governor level are all going well with as well as the private partners out here in the CNMI. Thank you for all the great collective collaboration. Thank you, Maxine.
Thank you so much, Chairman. I'll go ahead and get started with questions. Thank you so much, Governor, for giving more time for questions. The first is, will the CNMI get antibody testing in the future?
So with that, I think also the appropriate partner to answer that will be our CEO, Esther Munya. This what I can assure you, that our partnership with CEO and the task force chairman, we've made those decisions to get our test kits here a couple months ago, because we know how important to have a test kits here, and also to do the community based testing. And I'm sure if that's a route that we need to, first we need to also look at what are available out there and where can we source that out. And what are we trying to accomplish? I do know that we have, I believe, few types of test kits as well as machines on island. Again, the availability of test kits. But I can ask Esther Munya if that's something that we should move forward to, and then we're here to give the resources and perhaps what our CEO needs and the task force.
So yeah, Maxine, for the yes, the platforms that we work closely with CAC, the SOGENT, the Gene Expert, and the BioFire and the Abbott are in place, and we with the direction of CEO Munya, the IgG antibody, we did, that was the first donation that were made, but we are leaning forward on getting those resources in place. But we have sufficient platforms to perform surveillance and also confirmatory reading of the test results for COVID-19.
CEO Munya, I noticed that you unmuted yourself as well. Is there anything else you would like to add to that question?
Sure. Can you hear me? Good?
Yes.
All right, thank you. So, yeah, antibody testing is not recommended, at least at this time. There's there's studies ongoing about it. So far, what has been given an EUA is not 100% accurate. Putting people to be tested for an antibody testing to say that they're immune because they already had it can be problematic in public health. So, at this time right now, we've been looking at the EUAs, the emergency use authorization given by FDA for these antibody testings. However, again, not all of them are accurate. They have like maybe 50 to 75% accuracy level. And so at this point right now, it's, we can use it it has to be done and we usually provide that with a consultation with the medical staff. But right now, this PCR testing, the Gene Expert, the Abbott ID, those are looking for current infections. So it is actually useful for us right now at this point. Over.
Thank you so much, CEO. I'm going to maybe have time for 2 more questions here. The first has to do with enforcement. So a number of community members have raised concerns about enforcement or mitigation of the directives and the guidelines. This media source has received comments about instances in which certain businesses were not being compliant, whether that was from failing to enforce 6 feet and social distancing or failing to sanitize baskets and shopping carts. So where does enforcement or mitigation come into play here, and how should we hold individuals and businesses accountable?
Okay, well, I think first off, I would like to thank those concerns that are being raised. I think that when those concerns are being raised, I would like to also know how are they being raised? Are they channeled to the right department, whether it's ABTC or, am I okay? Is everybody, am I hearing? Okay. So I think that if we, if those complaints can go to the right department, whether it's ABTC or even the DPS for enforcement, or even I believe that there's a number that the task force has, then we can definitely go on and monitor the establishments. And we want to be vigilant and respect the customers and understand their rights as well, and we want them to feel protected, as well as the businesses as well. So if they can give those concerns or report to the proper channel, we'll definitely act on it.
Thank you so much, Governor. And maybe 1 or 2 more questions. I really like both of these. One of them is, what will it take to reach Code Blue?
Code Blue. We are, I believe we might be reaching that already. I'll be meeting with our CEO today, hopefully later on today, and look at when we reach that blue and then go from there. But I believe we might have enough test that's been taken by the community. So we'll be making those announcements as soon as I meet with our CEO and the chairman of task force.
That's great to hear. Thank you so much, Governor. And the last question is, does the Governor's Economic Advisory Council have plans to reach out to smaller businesses not usually in the conversation?
Yes, so the answer is yes. We plan to have the businesses definitely partake on this council. Obviously, we can't have all the businesses all together, but the respective members will be reaching out to have that conversation. And then before we roll anything out, whether it's short term, midterm, or long term goal, I'm sure that we'll be announcing those recommendations to me and from the advisors. But I would like to echo that all the members, the advisors that we have a good number and individuals that have taken their time. I will continue to give their input on how do we move forward with our economy. But I'm certain that they will reach out as much as we can, and as well as the advisors.
Thank you so much, Governor, and thank you so much, Chairman Villagomez, both for joining us here this morning and for taking an extended amount of questions. Is there anything else that you would like to add before? I know you have many, many other things to get to today.
Okay, so I want to thank you for giving this opportunity as well for myself and on behalf of the Lieutenant Governor. We want to thank all of our business partners. Sincerely, truly appreciate all your cooperation, your assistance, and your patience since we started this COVID. I am very blessed to have all of our business partners stepped up and even went beyond just the directive and made a lot of personal initiative or business initiative that was beyond the directive. And our community was receptive on it. And just even the reopening of CNMI, all of you have been really good. And I want to personally thank you as well. And we're here to work with you, and we're here to make sure that while we reopen CNMI, all of our employees as well as the owners, our health is continue to be our priority. But moving forward, again, we're here to make sure that your needs will be accommodated and as much as we can. Thank you for your partnership.
Thank you so much, Governor, and thank you so much, Chairman. We also do have CEO Munia, who's going to be giving a brief presentation later in this meeting with her team from the Bureau of Environmental Health that will also be available to answer questions. But now we're going to go ahead and turn it over to Congressman Khalili. He just arrived home, so we're really grateful that he was able to join us here on this Zoom call today. Thank you so much, Congressman.
Yeah, thank you very much, and good morning, Governor. Good morning, President Palacios, and to all of you, members of the Saipan Chamber of Commerce. Good morning, and thank you for inviting me for this opportunity. If I move this camera a little bit more, it's going to fall off. So, but before everything else, I want to say how remarkably our community has responded to back-to-back typhoons and now to the coronavirus. The resilience people have shown under the most difficult circumstances is frankly astounding. The sense of responsibility people have shown, understanding what each of us does as an individual make a difference to the health of those around us is astounding as well. The Marianas community deserves to feel a deep, deep pride in who we are and how we respond when life is hard. If there were any doubt about our strength and resolve, just look around. Yes, we had 2 deaths from coronavirus, but federal agencies predicted we could have thousands by June, thousands of infections, at least by June. And that prediction has proven false because we did what we needed to do, even though it was hard to wash and socially distance and avoid the kind of gatherings that are central to our culture. In addition to that, the directives issued by the governor's office and the cooperation of all establishments and all public agencies and individual families in the Marianas help to this exceptional accomplishment. So we have also avoided so far the civil unrest that we see in the rest of the country. And not because we're unfamiliar with racial prejudice, We know what it means to be political second-class citizens. We know our living standards are below the rest of the country. We know race is at the root, but we're willing to work for change through peaceful means, and we will persist, 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 just like our fellow Americans living in underserved and under-respected communities. By my count, the Marianas received $180 million to help the damage from U2 and Mangkut, and there are EDA grant applications in the pipeline to rebuild schools and other infrastructures destroyed by the typhoons. There is $244 million in community development block grant funds for disaster recovery set aside for the Marianas as soon as our spending plan is complete. And I'm working in Congress to leverage another $90 million from FEMA at the governor's request. This is a community disaster loan that can be converted to an outright grant if the Commonwealth meets certain conditions. America has been there to help us when we needed it the most. Now, just as we face back-to-back typhoons, we face the back-to-back health and economic crisis caused by COVID-19. And in Congress, we're doing everything we can to help. By my count, the Marianas has already received $125 million in emergency aid for the Commonwealth government, the public school system, and the Northern Marianas College, for our CHCC and everyone working in healthcare with food aid for children and families as well. Add the 1,200 emergency impact payments that are finally being paid out, that's another $45 million. Add the payroll protection program to help businesses pay workers and cover fixed costs. As a matter of fact, just last week, the House passed a bill to provide some flexibility, greater flexibility to the PPP program. And the good news is that the Senate has said that they will bring the bill to the floor for a vote as soon as possible. Maybe as early as this week. As of May 30, 362 Marianas businesses have loans for $35.6 million that should convert to grants if terms are met. Add unemployment assistance, which I know that the Secretary Benavente's office, their staff are getting training as we speak, they're trying to put up install the web portal that would allow people to sign on and register online. And that is another $70 million at first and could easily double or triple over the course of the year. Yes, Congress has provided what was needed to blunt the health threat and prop up businesses and households financially, but more is needed. The vice president of the U.S. Chamber of Commerce said, publicly said this day or yesterday that the CARES Act was a measure to respond to the emergency. But a step 2 is necessary, alluding to the HEROES Act. A step 2 is necessary to respond to economic recovery. And I agree with the vice chairman of the U.S. Chamber of Commerce. Because, you know, no one here thinks the crisis is over. We ask, how do we start a mass tourism economy and keep our community healthy? What economic alternatives do we have to develop? And how do we make ends meet in the meantime? We will be struggling to answer these questions for the months and years to come. In Congress, the House of Representatives has already passed more relief to help our communities and communities nationwide facing the same problem. The HEROES Act, as it is called, with about $3 billion for the Marianas. Yeah, you heard me right, $3 billion just for the Marianas. That should keep government services running, our schools and hospitals and ports. Esther could probably build the laboratory that she really wants to build. The HEROES Act will put more people more money in people's pocket. So until businesses reopen and they can go back to work, they can buy what they need for themselves and their families. And the payroll protection program and other innovations will continue a lifeline to businesses to get through the crisis. As I said, the House has acted, and in the Senate, Republicans are cool to the idea of providing more relief, and the president has issued a veto threat. I do not mean to politicize the issue. Those are just the facts. But I do expect that Republicans will come to their senses and more relief will be provided. And I promise to continue working to make sure the Marianas get every ounce of assistance we need to continue the recovery from U2 and bankrupt and get us through the crisis, coronavirus crisis. And I will now take questions. Don't make them too difficult, okay?
No worries, Congressman. Thank you again so much for taking the time to speak with us today. The first question is there an update on the second round of the Paycheck Protection Program for Marianas businesses?
A second round of PPP. I think the money has not been depleted. The pool of money that's available has not been depleted, and I think banker lenders here would continue to draw the money as they see applications come in, and for that they are responsible for. But let me ask: is Adam on the call?
All right, great. The next.
Yeah, hold on, Maxine. Adam, did I get that right?
Let me make Adam a co-host, and I believe he should be able to unmute himself.
There is 135 billion in PPP funds, but given Congress has acted to need to do that Congress would act.
Okay. Thank you, Adam.
Yeah.
Maxine.
I
hope I answered that question.
Yes, thank you so much, Congressman. The next question is, could you elaborate a little bit more on the bill that passed Congress last week and the different components that it has related to businesses and the PPP? I know you talked about the expansion of like 8 weeks to more.
Right. So the bill that was passed the House last week and is Senator McConnell has said he will bring the bill to the Senate floor for vote. It does several things. Among others, it extended the term of the loan. So rather than paying in 2 years, it makes it much longer. I think it may be extended up to 5 years. One of the also great provision there is the adjustment where at the present time you have to spend 75% of the loan on employees. There are businesses that don't necessarily that have greater cost on fixed costs such as rentals, equipment and those kind of things. So it reduces the 75% to 60%. And then again, I'm correct that it extends from 2 years to 5 years the terms of the loan, and there are other conditions in there that actually provides flexibility and for existing and those loans that could be processed in the coming weeks. I think there's another 125 or 175 billion dollars that's available.
Thank you so much, Congressman. And the last question that we have, is there any other pieces of legislation that you're currently working on or that you're excited about that you would like to share with the membership?
Yeah, well, excited, yeah, there's quite a few. But right now, the governor has asked us to get authorization for a community disaster loan. Appropriators are now busy at work subcommittee chairman of appropriations committee called the Cardinals, for example. They're the ones who actually write the 12 separate legislation that becomes part of the legislative bill, appropriation bill, the omnibus. And so we're working with the chairwoman of the Department of Homeland Security, trying to, I'm working with her to get this authorization for the Commonwealth to obtain a community disaster loan. The governor told us the $90 million, $93 million, but what we do is we language this in a way, because we're not allowed to do earmarks. So we language it in a way that is available to FEMA. There's no need for appropriating additional money. FEMA gets this pot of money every year. And so we language it so that territories could apply, because I'm treating the Commonwealth as a local government, because local governments tend to mean municipalities. But we language it where the Commonwealth is considered a local government, and also consistent with language that the Commonwealth government has as determined is necessary to lawfully muster, constitutional muster, to pass constitutional muster, and get the money, the $90 million, and use it for the lapsed revenue that we were not able to receive or generate because of typhoons Mangkhut and Yutu. It's a little tricky because our constitution does not allow to borrow money for operations, but we had to language it in a way that would pass constitutional muster, and we think we got that, working with our CRS and legislative councils, and now we're working with the subcommittee and reaching out to Department of Homeland Security, to FEMA directly, asking them for to look at the bill and give us technical assistance, comment if there's any comment they'd like to submit, and or more so provide support for the language so that it becomes a part of the appropriations bill. It does help when the departments or agencies then support for legislative language. Thank you.
Thank you so much, Congressman. That is all for our question segment. Is there anything else that you would like to share?
No, just thank you for this forum. Thank you for inviting me and my staff. We continue to work. We continue to work hard. Look, it's really, I come home almost every month when it was normal, but now coming home really a sense of I am just happy to be home, really. So thank you, everyone.
Well, we're really grateful that you are home, and especially grateful for all the time that you spend on the Hill advocating for our behalf. We have many businesses and individuals alike who are benefiting from many of the resources that you're currently advocating for on the Hill. So again, thank you so much for the time that you're spending there, and I hope that you get a little time to relax while you're home.
Yeah, I just hope that everyone who got that EIP money and everyone who's going to get PUA money, that they spend that money. See, that's supposed to be spent and goes out to the community, and it generates more revenue and all of those things. So someone told me that they saved the money. I said, no, you're not allowed to save that money. I'm just making it up, but I was jokingly telling that person, you're not allowed to save that money. You must spend that money so it gets moving into getting circulates into the community. But with more businesses opening up, I'm sure people will start, going back to the businesses and spend a little bit of money. Once we have a little certainty, once Secretary Benavente gets that PUA thing program up and running. If, like in the HEROES Act, it extends the PUA for, I think, another year and a half. If I'm not mistaken, it extends the 600 up to December of this year, or even longer than that. And that means, my goodness, I think maybe Secretary Benavente at one time, and we agreed with her, um, projected that it's possibly we can get $250 million into Mariana's economy through this PUA program. And we thank her for working hard on this. It's taking some time. I wish it was already happening, but there are things yeah.
Well, thank you, Congressman. You actually just did a great segue for me. We don't even need a host. But again, thank you so much for your time, Congressman, and for the rest of your staff for joining us today.
Thank you.
But I am going to move it over to Secretary Benavente. I will say, out of all of the questions that we've had coming in, this is the lady that everyone wants to talk to, and she knows it. So I really especially thank you, Secretary, for taking the time to join us today. I know that you've been hard at work for months trying to get this new program up off the ground. I'm also going to start sharing my screen right now as, and maybe with your opening remarks to start your presentation. Thank you again so much for joining us, Secretary.
Thank you, Maxine. Howdy, Tiromwami, and good morning, everyone. Chamber members, Governor Torres, Congressman Kilili, ladies and gentlemen. I'm here in the Department of Labor building with a few of my staff practicing our social distancing. Two of the staff that are here are PUA supervisors. We also have the lead coordinator for the PUA program, Eugene Tebeteb, and we have our administrative and hearing officer, Jacqueline Nicolas. Today's presentation is going to focus on employers because the Chamber of Commerce is made primarily of the employers in the CNMI. As you can see, the first slide will show you hiremarianas.com. We're encouraging all employers, all businesses to sign up, register, so that we can have their information online. The first step in registering, next slide please, will require the employer to provide, next slide please, information about who is signing up for that employer. Are you the general manager? Are you a third-party representative? Are you a direct representative? And all of the information required, including your federal ID, employer identification number. For a sole proprietor or self-employed, would be your social security number, and the company information, such as your mailing address, your NIAC code, contact information, number of employees, and so on. Creating the user account should be fairly easy once you log on to hiremarianas.com. Next slide, please. Once the employer is registered, you would go in and establish your username and password. Lately, we've been getting some actual pool applicants, but let me remind everyone, this phase 1 is only for employers to register. Phase 2, where for pool applicants, is not open yet, and I'll go into that at the end of the presentation. So creating a user account, you would have your password established. Next slide, please. Then you would state, who are you? What are you, the representative of the organization, or are you a third-party agent? This is important because some businesses hire a sort of runner or maybe an accounting organization that will represent them online. So there has to be an authority or an authorization for whoever is signing up for that employer. Next slide, please. More information regarding your employer identification. Fairly simple information. You're okay. Username, passwords, just like signing up to a new account online. Say you're signing up for something you're going to buy from Amazon. Establish your username, establish a password. Write these things down, especially your security information, in case you as the employer forget your password, at least you have a way of getting it back to you by answering the correct response to your security question. Step 2. Next slide, please. The employer verification is going to be done by the CNMI Department of Labor. After you're registered, there's only one slide. The CNMI Department of Labor will verify the information by obtaining your business license and your W-9, is that the right one? W-9 tax forms. Basically say who you are, and it verifies your federal EINs. So that's what CNMI Department of Labor is going to do. And then moving on to step 3, separation notices. This is where it goes back to the employer to state who are the employees that were separated, either furloughed, reduced hours, terminated, let go because the business shut down, whatever reason. This is where the employer comes back in and lists every single employee that is separated from the company or had reduced hours from the company. Next slide, please. And then after that, we will open the portal for PUA applicants once we receive the funding from US DOE. These are contact numbers that we've published to the general public, 989-9080 and so on. As you can see on the bottom, there's a 989-9095 number we've established for reporting fraud, tips for say an applicant is not putting in the correct information or misrepresenting what he's putting down in his PUA application. Callers can dial this number and we will take the information and do the investigation with our Division of Enforcement. We also have an email address, info@puamarianas.com, which is open 24/7. The telephone lines are only open from 8 a.m. to 12 p.m. And the reason for that is because the department still is undergoing some training with the U.S. Department of Labor. Since April, we've gone through 4 clinics, and we're going through 2 more in the next couple of weeks. We've gone through training for initial claims, adjudication, benefit payment control, and then actually in a couple of days, we'll go through appeals training and federal reporting training. So the entire Department of Labor team is going through this training because CNMI does not have an unemployment insurance program. We had to start from scratch. And so I'm very grateful to our administration for supporting us in going through the training and having to do this mostly online, and then having to come back into the office and make sure that our offices are retrofitted to ensure safety and health precautions in light of the fact that COVID-19 is still in the CNMI. We received our notice of the award from Nick Laupius, who's the regional administrator from the U.S. Department of Labor, just a few days ago. And so we're hoping that the money for PUA and FPUC will be transferred to CNMI very soon. Now, this portal that we opened on May 26th, Maxine, I'll let you know that we have over 400 employers that have already registered. And for me, that's a good number because every quarter, the CNMI Department of Labor receives about 900 employers' quarterly submissions, quarterly compliance documents. So we're about halfway through the list of employers that we have in our system. I really like to encourage all employers, whether your business is open or not today, to register so that we can have you online. And also, this system will be used to help our job applicants re-enter the workforce once we open up for business completely, going into that blue level. So this presentation, Maxine, will focus on the employer side. We will have another webinar for PUA applicants and how to register online as well in the next few days. So you said that there were some questions for Department of Labor?
There are, and we're so grateful that you're willing to answer them. The first is that, is there a plan for there to be an income disregard for PUA, if any?
Yes, we have an earnings disregard that we will have in place, and it is the same amount that is in the state of Hawaii. That earnings disregard is $150. And we will be putting out a video to show how the computation is done for earnings disregard for a PUA applicant. Next question.
All right, next, we have a few employers that are just wanting to know the general timeline that CNMI Department of Labor will get back with them. I know that you've said that you've gone through over 200 already. Do you think over the next 2 weeks they should be hearing from the CNMI Department of Labor, or what do you think the general timeline is?
Yes, we have over 400 employees that are registered to date, and we are trying to push out the verification, which is the step 2 process, within 24 to 48 hours. We're going to push that time frame out a little bit more because some employers did not submit their business license, and they can do that online. They can upload those documents, and so that takes a little bit more time. If an employer registers, please upload your business license and your W-9 form at the same time.
All right, the next question, what other forms of income disregards are required by law with respect to receiving PUA? So I think that question is meaning what types of income, like does it include health benefits when trying to calculate? I know that you said you'll be putting out a video separate to that. Would it be more appropriate to ask at that time, or do you think that when somebody
Well, I can tell you that, Maxine, health benefits are not counted against PUA benefits.
Perfect. I think that helps answer that question. When can the community expect to begin filing for PUA?
The community can expect to begin filing for PUA as soon as the CNMI government receives the funding from U.S. Department of Labor. As I mentioned, we received the notification from U.S. Department of Labor Regional Administrator Nick Laupius just a few days ago. And yesterday we were also informed that the process is ongoing and should be approved very soon. For me, very soon means tomorrow, but I won't say that for a U.S. DOE. Remember, there are 40 million unemployed Americans in the United States at this time. 40 million people are in line for PUA in the United States. We will have about close to 10,000 applicants here in the CNMI. And be that as it may I also mention that we're in the same lineup as the island of Guam, the Federated States of Micronesia, the Republic of Palau, the Republic of the Marshalls, we're an American Samoa. And so we're actually in the same training sessions with our sister territories.
All right, the next question, this person also wants to let you know that the CNMI DOL staff helplines have been great, but they want to clarify for FPUA, for FPUA and PUA, do they use the same higher Marianas claim?
If you apply for the PUA, the Pandemic Unemployment Assistance Program, as a PUA applicant and you are deemed eligible for PUA, even if the amount is $1, you will automatically be eligible for the FPUC, the Federal Pandemic Unemployment Compensation Program.
All right, the next, I think this is one of those million-dollar questions. Are CWs eligible to apply for PUA, and what would you recommend?
At this point in time, we know that qualified aliens are eligible to apply for PUA. And we understand that qualified aliens mean that someone with a green card and someone who is an EAD card holder with a particular visa status. We have asked the question, are CW1 employees eligible? And we have not really gotten an official statement from the U.S. Department of Labor. We continue to ask, and we continue to wait for an official statement. To also let you know, when it came to DUA, Disaster Unemployment Assistance, last year, right after Typhoon U2, CW1 workers were not eligible for DUA. But again, we encourage everyone to apply, and then we will see who will qualify.
As a sole proprietor, do you have to register as an employer if you are planning to apply for yourself?
You may register as an employer, self-employed, or you may register as a PUA applicant and indicate you are self-employed.
The next two questions I'm going to ask, I think that you've answered them in a roundabout way, but I just want to make sure that the asker hears it very clearly. So some employers who have already registered for phase 1 contacted DOL and were apparently told they need to wait a week or two for account verification and confirmation due to some issues with the DOL system. And we know that employers can't apply for PUA until their respective employers' accounts have been verified and confirmed. So the question would be, for the general public would like to know what exactly the system issues are that are delaying the verification and the confirmation of employers' accounts, if there are any issues.
I think the issues are the lack of documents from the businesses is one. And also, we just started this portal system on May 26th, it's a few days ago. We are still pushing it out as fast as we can as a team of employees. We're going to try and make the turnaround as we promised within 24 to 48 hours for the employer verification.
Thank you so much, Secretary. And then the last question, again, I think that you've somewhat answered it, but just to be clear. So some employers are unsure what happens after registering for PUA and submitting their documents. I think I'm getting to the bottom of this is that so employers should have been contacted already if they've sent in their business license. Is that correct? Or I think that a lot of employers are a little confused because they feel like they've signed up for the portal and they feel like they're still waiting to be heard from CNMI DOL. So what is being done for those that have not received that email?
Okay, first, what's a good idea is to first make sure that all the documents are in the application from the employer. The employer needs to submit the business license and the W-9 form. Secondly, those telephone numbers that are listed, feel free to call and ask us, what's up with my verification? You know, how long will it take? Where are you at? We have 7 lines there, 7 staff dedicated to answering the questions. I'm looking at my team saying we better, try and move these out a little faster. This is a new system, but we are doing our best to push them out again, 24 to 48 hours. We will do our best.
Thank you, Secretary. So for this final question that I have, there was a thanks to the governor for allowing the administration leave for our CNMI soldiers and reservists in your EO on 2018. However, for you, Secretary Beneventi, will the Army reservists be paid via the military affect their PUA employment and benefits?
What's the answer to that, Eugene? Say again? That's a question I've never had about military benefits, whether they will affect PUA benefits. Can I get back to you on that, Maxine?
Yes, thank you so much. I'm glad that we were able to figure that one out, because I do know that there are a lot of reservists here on island. So to all of our member participants and Facebook Live participants, I tried my best to make it through all of your questions. If you do have any further questions, I know that Secretary provided the info@hiremarianas.com. Did I get that right?
No, Maxine, it's info@puamarianas.com
so
for questions about PUA.
Extra remember, because I got it wrong, info@puamarianas.com. Make sure you send your questions there. And the CNMI Department of Labor has done a great job of issuing many phone numbers that you can call, including a line for fraud. Please continue to follow up and talk to our CNMI Department of Labor. And thank you again so much, Secretary Beneventi, for you and your team and all your hard work trying to get this program that started from nothing up and running within a few weeks. Is there anything else that you would like to add before the end of the presentation?
Just like to add a shout out to the CNMI frontline workers, especially the CHCC team, DFEMS, DHS, CPA, everyone involved with this, and also appreciation to the CNMI businesses who are following what it takes to keep our community safe and healthy. Good job, everybody. Thank you.
Thank you so much, Secretary. And again, another time, it's like I don't even need to be the host. We're next moving right along. I'm going to be introducing CEO Munya. We're going to hopefully go ahead and get started here in talking specifically about updates from CHCC, but also really getting into and diving deep to the CHCC Bureau of Environmental Health and their regulations for businesses. So thank you so much, Esther and your team, for joining us today.
Thank you, Maxine, President Velma Palacios, of course, our Governor and Congressman Sablan. Thank you for being here. So, you know, COVID-19 is a long-term threat to public health. It seems to be the most disruptive infectious disease threat the world has faced, and even especially here in the CNMI. There's a risk of explosive spread until there is a vaccine, and that could be months or even years. So we need to follow the best public health practices and provide practical, actionable information to guide the policies and behaviors. The President of the White House has given a guideline for opening up America. The core state preparedness responsibilities include the testing and contact tracing, which is able to quickly set up a safe and efficient screening and testing sites for symptomatic individuals and trace contacts of COVID results. It is also working with collaboratively with the task force, ensuring a healthcare system capacity, ability to quickly independently supply sufficient personal protective equipment and critical medical equipment, and ability to surge ICU capacity, which is what's happening right now with the alternate care site buildup. So what Caitlin is going to be presenting is the COVID-19 Community Vulnerability Alert System. It's protecting the health and promoting economic growth and reducing the risk of reopening. It is empowering the public. It increases accountability. So, you know, before I go ahead and introduce my team, which is, of course, Caitlin Macano, and we have Eileen Beneventi and John Tagbell from new name for their division is actually Bureau of Environmental and Environmental Health and Disease Prevention. And contact tracing and surveillance is now under Mr. John Tagbell as well. So without further ado, I want to introduce Caitlin. Again, I just want to mention one more thing. I'm sorry. One more thing is that, you know, as I mentioned before, and you know, Tom Frieden had mentioned this. This is we're not closed versus open. It is a dimmer dial and not on and off switch. So anyway, again, Caitlin McConnell.
Thanks, boss. Maxine, I shared a first slide. Can you see it?
Yes, I can. Thank you so much, Caitlin.
Okay, great. Hi, everybody. Like CEO Munoz said, my name is Caitlin. I'm normally the Special Assistant for Policy, Sustainability, and Development for the CHCC. During the COVID response, I'm working on our communications team. And I'm just going to line up or introduce this kind of concept of our level approach to scaling up. Like Governor Torres said, we have color levels. And the color levels are based on the testing rates and the percentage of tests positive. So those are two factors that are taken into account when the governor decides to level up, or it could be level down as well if we see a significant outbreak. So right now we're at the level yellow, and the Bureau of Environmental Health has established guidance for each of the levels. And has issued the guidance for the current level yellow and has begun conducting inspections, and also has approved at least, I think, 23 restaurants now for limited capacity dine-in service. So I'm just going to hand it over to John Tagbell or Eileen from the Bureau of Environmental Health to go over some of those requirements and recommendations for level yellow.
Thank you, Kate. Half a day and good morning, everyone. Right now, we went to the yellow color, and yesterday and Monday, we have inspected 24 establishments, more than 24, but we have reopened 24 under the COVID training that we did. A few of the establishments didn't pass, so we gave them time to fix it up, and then they'll call us in. Those small businesses right now, some were inspected Monday and Tuesday, and they decided not to open, but not to have a dine-in, but a takeout still. So, but our time right now is 24 hours turnabout if the request comes in for inspection under the COVID. Under the COVID training, we show videos for the managers and the employees, and that's what we check if they have a valid sanitary permit, and then we give them a certificate for the COVID that they're compliance with our requirements. Right now, as of last night, Governor's Task Force, the ABTC went out and we were coordinating. They advised me of the inspection at night that they were doing. So, and we have seen an increase in our training. We're still training food safety training, but unfortunately, we have limited of 10 and the spacing of the 6 feet. So we have increased the days of training from Monday, Tuesday, Wednesday, and Thursday. And that's about the update. And I will give it to my colleague here to, if you guys have any questions or on the slides that is coming up.
Good morning, everyone. This is Arlene, Environmental Health Officer with the Bureau of Environmental Health, or the Environmental Health Disease Prevention Program. I'm going to quickly go over the requirements under the different levels, specifically under level yellow, which would allow for dine-in.
Eileen, could you either speak more closely to the mic?
Apologies. Can you hear me now?
It's a little bit more clear.
Okay, I will try to speak up. Is that better?
This is better. Thank you so much.
Okay, thank you. All right, so this guidance is not something new. Most places have already had COVID-19 prevention measures in place for the past couple of months. There are just a few additional measures included, which we've pulled from CDC's reopening guidance. So as part of the requirement, establishments must enforce strict personal hygiene and hand washing for their employees. The person in charge or the manager is responsible for ensuring that proper use of face coverings, availability of hand washing and hand sanitizing stations, and then there is an adequate supply of liquid hand soap and paper towels or cleaning and disinfecting solutions. We recommend that establishments avoid using or offering frequently touched items such as menus and condiments, and instead opt for eco-friendly disposable or single-use items. If available, we also recommend touchless payment options to reduce contact. Next slide, please. Okay. Establishments are required to provide physical guides, such as the tapes on the floors or sidewalks, to ensure customers are maintaining that 6 feet distance. They can ask customers to wait in their cars away from the establishments while they're waiting to pick up their food or to be seated for dine-in. Signs must be posted on how to stop the spread of COVID-19, how to properly wash hands, providing notice to customers that no one with symptoms will be permitted inside, and how to properly wear face coverings. Sample signs are available on the CHCC website. I will go more into that later on in the presentation. Establishments are also supposed to post one-way flow signs for entrance and one-way flow signs for exits to maintain crowd control. Okay, at all levels, it is required that establishments adhere to strict cleaning and disinfecting procedures for frequently touched surfaces. You want to make sure that they wash, rinse, and sanitize all surfaces which come in contact with food after each use. Some recommendations to support employee and customer safety is to consider assigning workers at higher risks for severe illness, either due to their age or underlying health conditions, duties that minimize their contact with customers and other employees. Consider installing physical barriers such as sneeze guards, partitions at cash registers, or other pickup areas where it's difficult to maintain that 6 feet. To reduce potential contamination, we advise establishments to discontinue preset tables, remove the condiments, utensils, and tableware, provide this as customers are being seated. We are also now requiring additional training provided by the National Restaurant Association, ServeSafe. Employers must ensure that all staff complete the free online ServeSafe training. There are 3 specific trainings for takeout, delivery, and dine-in. To help managers move things along, we are allowing managers to conduct mass employee training and provide a signed login sheet of employees to our inspectors. Upon completion of the training, certificates of completions are issued, and we encourage establishments to post it up so that there's added assurance to their customers. We require some type of employee health plan, and it can be as simple as sending employees home if they're experiencing any of this COVID-related symptoms such as cough, fever, and difficulty breathing. Consider conducting daily health check-ins. You can do temperature checks or symptom screenings. If you do conduct health checks, conduct them safely and respectfully. Implement flexible leave and other flexible policies and practices such as telework if that is available. Specific requirements under our current level yellow for restaurants that wish to offer dine-in service. Dine-in is limited to 25% of the original occupancy. Patrons must make reservations to control volume, and managers or the person in charge is required to maintain records of 1 point of contact for each party, and this is for contact tracing purposes. Party size will be limited to 4, and all parties must maintain that 6 feet distance. We recommend that they offer outdoor seating whenever possible, and to remove self-service options such as buffet-style dining and beverage refill stations where glassware, cutlery, tableware is out in the open and exposed. Okay, so for restaurants that wish to offer dine-in service, when you think you've met all of the measures in place, you can visit our CHCC website to request an inspection. That would be www.chcc.gov.mp, or you can call our CHCC BEH office at 664-4870-72 or 73. We're available Monday through Friday, 7:30 to 4:30. Once requirements are met, a compliance certificate will be posted at the entrance, as well as a listing of compliant establishments posted to CHCC's webpage or social media accounts. For additional resources, like I said, you can visit our CHCC website, chcc.gov.mp. Click on the link for COVID-19 information, and on the right-hand side, there's specific resources for restaurants, which includes a toolkit that has signs that they can put up. The checklist is available on this webpage, and so are other resources from our federal partners, which is the CDC and the FDA. All right, I will leave it to John for any additional information or questions. Thank you.
I actually don't question myself, but it's open for you, Maxine.
All right, great. So our first question, I'm getting a lot of questions. If we can share the slides at the end of this presentation, will they be available?
We can post it to the website too, Maxine.
Perfect. We'll go ahead and send the link out for that. Thank you, Caitlin. Let me go right back over. So employers are requiring their employees to get tested. Do you think restaurants or hotel owners can also do the same for its customers or guests before entry, like a certificate that they've been tested? Is that something that BEH or CHCC would be looking to require?
At this stage, our recommendation is not to take any additional testing, require any additional testing. All the preventive measures are in place. The testing itself is not cost effective to everyone involved, including the small businesses especially. So, but we might change down the road. However, it's open for any establishment, whatever they decided on. or business owner.
Thank you so much. The next question is, if a business has failed their first inspection, how much longer should they wait until, or how much could they expect to wait before they can receive another inspection?
At this stage, like today, we have a 24 hours turnabout time for inspection. If they feel that they're going to be compliant after our inspection. However, if they didn't comply the second visit, then we'll have to charge them. But we normally set it out, give them recommendation, everything that needed to be done. But before we go in, the Public Works has to come in for the occupancy numbers of seating that is available if it's at the dining, and then they'll put in a request, and we'll turn around with that request within 24 hours.
The next question is, are hotel restaurants also going through this process, and do they have the ability to get cleared for dine-in as well?
Could you repeat that question, please?
So the restaurants that are in the hotels, do they also have the ability to open, or is it only for standalone restaurants right now?
Yes. But however, buffet line will be really scrutinized if it's exposed to. So we don't recommend the buffet line to be open. A la carte will be the most appropriate meal.
The next question is, can businesses serve alcoholic beverages? And so is there a limit on the number of alcoholic beverages sold per customer?
At this stage, yellow stage, we don't, alcohol is not allowed.
So I'm just going to repeat what was just said from BEH, and that is that alcohol should not be served at any dine-in restaurant. Is that correct?
That is correct.
Great to hear. To clarify, because I know that was confusing for some of our businesses. The next question, we've had a few trying to clarify the difference between their restaurant and a bar. So with the order, it says that bars are to be closed, but there are restaurant bars that can be open. Can you provide the further definition just so businesses know who they are and they're allowed to be open right now, specifically for food, versus if they are the bar that is supposed to remain closed?
Okay, there's bars that are standalone, and there's bar restaurant where there's a small component of the beverages are served from the small bar to complement the meals.
And the next question is, in some restaurants, there are protective barriers added onto tables to allow for patrons to take off their masks and eat. Is this one of the protective measures that BEH is putting forward to require in restaurants?
That is correct, and the prerequisite is they mark out the distance, and they may have 4 people to a table, to accompany of the table, but there will be a distance that is marked off by the management or advised by DPW building code.
Okay, I think that's most of the questions that I've seen specifically for BEH, but CEO Munya, maybe you would be able to answer this question. If we continue with low levels of infections, how will CHCC respond? Will it maintain the extra capacity just in case, and how long can that be sustained?
I'm sorry, can you repeat that?
Yes, if we continue with low levels of infections, how will CHCC respond? Will it maintain the extra capacity that we have now in case that we do have a surge of infections? And how long could that extra capacity be sustained?
Yeah, I'm wondering what capacity are you talking about? Are you talking about the capacity for hospital or?
I'm going to go ahead and just say the capacity for the hospital on behalf of.
Oh,
yeah.
So that's again, one of the reasons why we have the ACS. Right now we have the low numbers. However, again, one of the key ingredients of ensuring safety and public health safety for our population is to have key ingredients, and one of them is the ability to test, ensuring that we have hospital capacity, which is why the ACS is still ongoing for reopen, for opening to address the surge, if there is a surge, and having a robust contact tracing team. So we have those ingredients, and working with. We will be continuing to have a conversation and trying to develop a guideline for us to, when tourists are basically allowed to come in, we want to make sure that we have the ability to protect the CNMI. So we will continue to make that a priority, and we're hoping that, and actually we are getting a lot of support from the task force, and so hoping that that continues on, to ensure that we are there to help. So
thank you, CEO.
I hope that answers it.
It does. The person who asked the question also stated that. So there are just a few more questions, I think, for you. So there's one that says, if a person tests negative before boarding their flight to Guam, do they need to quarantine for 14 days in Kanoa?
So the quarantine is in PIC for those that are arriving on island from travel. At this point right now, we are not accepting any test results from off island. We want to be able to allow at least 5 to 7 days of quarantine before we test anyone. And for those that, of course, there is some exemptions, and those exemptions are key to, for example, they are here for critical infrastructure, critical response. We need to give them that exemption, but that exemption includes a testing on the first day, but with a continuous monitoring system with the SAR alert that is connected to the contact tracing, connecting to our data system, so that we have continuous monitoring of individuals that are entering in the CNMI.
Thank you, CEO. For some of our larger businesses that have many employees, is there any potential way that a business can coordinate with CHCC or the testing center to have a testing site go to their place of establishment if they have a few hundred employees to get tested? That's one question.
That is being discussed with the task force on the next steps. As the airport opens, community-based testing at the airport is probably not as practical as it is now. So the intent is to bring the testing to the communities. We are bringing it to communities, and we mentioned community. Sorry, excuse me, I don't know why this.
You're a very important lady. We know that. So while
okay, so the community, I'm sorry. So the communities, we are going to the communities. We find it actually easier for us, for our team to come and go to, for example, we went to the Department of Corrections. And when we did that, we basically swabbed 140 individuals in 2 hours. So for us, going to a private sector or any business, that would be actually even better for us. So, but again, it's in the planning on how do we arrange that, but it's definitely in in development.
Thank you, CEO. And I think we have time for just one more question, and this has to do with moving beyond level yellow, specifically about businesses getting their compliance. Will businesses need to be recertified as we enter new levels of community level yellow to blue? Or is there any plan that in a certain amount of time that a business has to get retested or recertified for allowing for dine-in or just for a certain occupancy?
Yes. Simple answer is yes. If the change color, we already have the listing of all the compliance establishment. We just want to make sure that the public consumption, they see that if it's changed to blue, then it's a blue, their compliance with blue. So basically, it will be the same requirement. We just need to change that up.
Perfect. Thank you so much for the team at the Bureau of Environmental Health at CHCC, as well as CEO Munya for joining us today. They did mention that the slides in this presentation will be available on their website, and we'll go ahead and share out that link later when it is available. I also had a few questions about other presentations. All the presentations that we have today will work with the different speakers to send out to our chamber membership. I did want to go ahead and just say a big thank you again for all of the speakers today for taking time to be with us, for all of our chamber members for joining in, and I'm going to hand it over to President Velma Palacios for any closing remarks.
I guess I was muted. So thank you all to our speakers, Governor Torres, Congressman Kilili and his team, Chairman Villagomez, CEO Munya, Secretary Benavente, and to all our chamber membership and everyone watching. So I hope this is very informative, and it was informative to us, and we thank you all for taking the time out and just having a dialogue with us. And we hope to continue this. And if there are any other questions, please email us at our chamber office so we can send it out to all these respective speakers. And the chamber continues to help, what we can do in the community. We work with the Congressman's office and the administration and everyone just to see what we can do. Again, we're all in this together, and it's a public-private partnership, and we want to continue that. And just to continue to help to keep our community safe and reopen our businesses, reopen our economy, and start hopefully getting our tourists back. But they need to feel confident that we are a safe community or a safe location to visit. I thank you all for your time, and please stay safe and social distance. And we hope to see you again. Have a great day.
Thank you, everyone.